is Julia, I'm from Brazil, and I'm currently a student of PPCR 2020 Principles and Practice of Clinical Research. And finally guys, I made it. Let's do a review of Module 2, Basics of Statistics, and the bibliography I'm using is our course book, Critical Thinking in Clinical Research. Look guys, I'm a student, I'm not a TA, okay? So critical thinking while watching these videos. Okay guys, so in this video I'm gonna focus on parametric tests. And first of all, we need to know what are these tests. Those tests are statistical tests which have lots of assumptions in order to provide robust data at the end of the day, right? So these tests, they are more powerful than non-parametric tests, just exactly because these tests really have lots of assumptions we have to respect in order to have robust data and not produce some misleading result at the end of the trial, right? And what are these assumptions we have to respect to run parametric tests? Well, here we go. The outcome needs to be a continuous data, so it has to have order, and the spacing between each number is also meaningful and it can be measured, and it is interesting for the trial. We have to have a random sampling technique as well, equal variance, which I'm gonna explain a bit, and normal distributions. So our data set needs to be normal distribution, needs to have the bell-shaped curve when we are talking about central tendency measures and dispersion of the data. Okay guys, so now we're going to talk about ANOVA, which is analysis of variance. So we're going to analyze how groups vary among each other, right? And the differential is that ANOVA is capable or is able to compare more than two means. It can compare to means, but then it loses the purpose, because we can apply a t-test with two means, right? And which is simpler than ANOVA, but it can. However, if ANOVA detects a significant difference among groups, it does not have the power to say between each group or between each pairwise is the difference is significant, right? So then we would have to do a post hoc analysis, so analysis after running the statistical test. Okay, well, so ANOVA, to run ANOVA, we need to follow two steps basically. The one is ANOVA analyzes the differences within groups, and then differences between groups, and then if we have significant differences, we need to run a post hoc analysis, right? Well, so I have two types of ANOVA. One way ANOVA, which analyzes only one independent variable, so we analyze the effect of a combination of factors, of a combination of dependent variables in the mean of these one independent variables, okay? And two-way ANOVA is we are going to analyze the effect of a combination of factors, a combination of dependent variables on the two independent variables, okay? So these, although they are independent, these two independent variables, they can be altered the same way or not by this combination of factors. Okay, well, so what are the advantages of running a ANOVA? Well, as I said, it can analyze more than one independent variable, and it can analyze more than, not equal. And it can analyze more than two groups, okay? It is a pretty robust test, so it is robust enough to support or to ignore some small violations in normal distributions. However, we need to be pretty pretty careful when running ANOVA in a non-normally data distribution, because we don't know exactly how to quantify these small violations of normal distribution data. Okay. And then ANOVA is also easy to understand, and it is pretty common to be used. So actually this helps. It's like a circle, right? And it does not really assumes an equal sample size between or among groups, right? Differently, for example, from unpaired t-tests, in which the two groups need to have the same sample size. However, the disadvantages is that it does not access the pairwise differences, or pairwise is like subgroups, so like two groups differences. Okay, so we need to perform a post-ROC analysis to identify between which pairwises the difference is really significant. We have here some wayouts we can access this difference. So the first one, that is actually not a way out, not a good way out, is to perform several t-tests. So that is actually not good because it inflates the alpha, the level of significance. So let's say that running one t-test, my level of significance is 0.995, which is the regular alpha, right? If you run, for example, 4, 5, 6, let's stay with 6. If we run 6 t-tests, if we have like 6 pairwises that we want to analyze, then this alpha would be like this equation here. So then we would have a pretty lower p-value. So we would have much more chances to make a type 1 error. So running several t-tests really decreases the power of the analysis, and we could confirm, or we could establish that some pairwises really have significant differences when they do not. Okay. Another more adequate comparison could be comparing pairs. So the most common one is the Tukey method. So this method access the experimental group against the control group, and it is performed when the type 1 errors, so type 1 error is more significant. So we should be more careful than making type 2 errors, for example. So type 1 errors are more important here.
For example, when we are talking about an antibiotic, if we say that a new antibiotic X, for example, is better than a standard treatment antibiotic, then we could alter some protocols that we could put patients at risk, because the null hypothesis was confirmed wrongly, incorrectly, right? So that would be a situation that we should use Tukey method.
But if we need a more powerful test, then we can go to Newman-Kuhl's method. So this, as it is more powerful, it has more accuracy on confirming the results. So I can prevent more, let's say so, of making type 1 errors. So what is type 1 error? It is failing to reject a null hypothesis that is false. So here,
for example, when developing drugs to HIV, for example, back then when we knew nothing about, every little significant result was good because we didn't have any treatment at all. So when we needed to reject this, even if we have like small differences, that was significant. So we really need a more powerful post-rock analysis, right? So then Newman here would be the best way out.
But again, these two tests, they compare pairs, right? If you want to compare multiple groups, then we can run, for example, a Sheffi method. It is more powerful than the Bonferrini, and as the same thing, it is applied when the situation, when it is more dangerous, let's say so, making a type 2 error than type 1 error, and it compares the means of the groups against a grand mean. And then we have the most famous post-hoc analysis, which is the Bonferroni method. It is a method of correction of the alpha, the level of significance of statistical tests. And how do you do that? So beta, which is like the chances of making type 2 errors. So we can have like an alpha corrected when we are analyzing pairwise. So it would be beta equals alpha divided by the number of the groups divided by 2. So it would be alpha divided by half of the number of the group. Okay, and that is a pretty precise post hoc analysis, and it is pretty famous actually. And that's it.